By now, you've learned how to provide compressions and give breaths with and without a mask. Let's look more closely at using an AED. An AED is a device that can deliver a shock to the heart of a person in cardiac arrest if needed. Even though you may be in the midst of providing CPR, once the AED arrives, use it immediately. CPR combined with using an AED provides the best chance of saving a life. If possible, use an AED every time you provide CPR. During cardiac arrest, the heart quivers and stops pumping blood. An AED shocks the heart so that the heart's rhythm can reset and the heart can pump blood again. To use an AED, you simply turn it on by either pushing the on button or lifting the lid. Once you turn on the AED, you'll hear prompts telling you everything you need to do. AEDs may have two sets of pads, a large set to use for adults and a small set to use for children. Make sure you use the large pads on anyone 8 years of age or older. Later, we'll talk about using the smaller pads for children younger than 8 years old. You may have already moved some of the person's clothes out of the way to perform CPR, but you should remove all clothes that cover the chest before using an AED. AED pads must not be placed over any clothing. It's important that the AED pads not touch anything other than the person's bare skin. Peel away the backing from the pads and attach them to the person. Follow the pictures on the pads. You don't need to remove a person's jewelry as long as it doesn't interfere with the placement of the pads and isn't in contact with the pads. It doesn't cause a shock hazard to either the person being helped or the rescuer. However, undergarments should be removed, along with other clothes covering the chest, since they often interfere with proper pad placement. Plug the pad's connector into the AED and follow the AED prompts. Make sure no one is touching the person while the AED analyzes the heart rhythm and before you push the shock button. If the AED recommends a shock, it will tell you to stay clear or not touch the person. If the AED tells you not to touch the person, look to be sure that no one is touching the person, including you, and state something like, "Stay clear," or "Stand back," just before you push the shock button. As soon as the AED gives the shock, immediately resume chest compressions. After this demonstration, you'll have a chance to practice using an AED trainer so that you can see what it's like. You'll need to consider a few special situations when using an AED. First, if the person has hair on their chest, the hair may prevent the pads from sticking. If the hair prevents the pads from coming in contact with the chest, the AED should tell you to check the pads. If it does, press the pads down more firmly. If your AED has only one set of pads, a razor should be included. You can use the razor to quickly shave the area and then apply the pads. If your AED has two sets of large pads, you can try this. Apply one set to the hairy chest, and if the hair prevents the pads from coming in contact with the chest, rip the pads off forcefully, removing the chest hair. Then, reapply a new set of pads to the bare skin. Water on a person's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the person's heart. If someone is lying in water, you should quickly move them to a dry area. However, if the person is lying in snow or in a small puddle, you may use the AED. And if the chest is covered with water or sweat, wipe the chest before attaching the AED pads. But wipe the chest quickly. It doesn't have to be completely dry. Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump smaller than a deck of cards. If you see this lump, avoid putting the pads directly over it. Also, don't place the pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before you put on the pad. If you're not wearing gloves, make sure you don't touch the underside of the patch. You don't want to get any of the medicine on your bare skin. Use an AED for a pregnant woman in cardiac arrest just as you would for any other person. If your workplace has an AED, you should familiarize yourself with it. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. Additional emergency equipment may be found in the AED, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit. The video will now pause to allow your instructor to lead a practice session with an AED trainer. These trainers simulate what a real AED would do, but they won't provide a shock.